I am Casey Simon, and I'm going to be doing my presentation on Chinese Americans. I want to start off with just a quick overview of China and their religion and some of their beliefs. Let me start my stopwatch. They make up the eastern portion of Asia, and the country as a whole is a little bit larger than the United States. Most of their land is mountainous, with the lower part being more plains. In 2001, their population was about 1.2 million, which comes to about 331 people per square mile. The capital of China is Beijing, which most of us do know. And most of their agriculture consists of rice, wheat, potatoes, grains, tea, and cotton. In 1998, most of the workforce was strictly agriculture. About 24% was industry and 26% was services. The ruling government in the United States is the Communist Party. The majority of the Chinese Americans that immigrated to the United States came from Taiwan, Hong Kong, and mainland China. The states that have the largest population of these Chinese Americans are California, New York, and Hawaii. The average age of a Chinese American living in the United States is 32.1, whereas the U.S.'s general population is about 33 years old. Of the Chinese Americans living in the United States, about 7.5 are over the age of 65. Chinese Americans are known for maintaining a high level of education. 35% of them do go on to receive their bachelor's, which is a little bit higher than the United States. In 1965 is about when the immigration laws started to ease up a little bit on immigrants, and it allowed for more higher educated Chinese Americans to come over. And nowadays, most of the time, the whole family just comes instead of just one person who has a higher educational level. Chinese Americans are encouraged to pursue righteousness and wisdom and have harmonious relationships with nature and other people, and you are supposed to always accommodate other people rather than yourself. You're expected to be sensitive to what other people perceive and to be gracious of what is given to you. Interpersonal relationships have a hierarchical structure, so the older or higher status people have authority over the younger or lower status people. This can be based on age or just your profession. For example, brothers will talk to their other siblings by saying either younger brother or older brother, not so much by their name. The official language of Chinese is Mandarin. There are tons of dialects actually spoken in China, which aren't always understood by all people who speak Chinese. So, but the one thing that does stay the same is how they write. So even if they can't communicate verbally to each other, they can write it down and it will be the same. It says that even though it's been around for 3,000 years, but it has gone several great changes, so they can communicate by writing. There are 4 tones when they do speak. There's a neutral, a flat, a coarse, a rising tone, and it depends on how you say the word, but it can have 4 different meanings depending on the pitch of the word. The Chinese do value silence more than Americans, and they tend to avoid disagreeing or criticizing each other, and this is true especially in public. Oftentimes they will answer most things with just a simple yes or a head nod. They don't normally touch each other during conversation, and touching someone's head during conversation is considered a serious breach of etiquette, and especially towards someone who is elderly or of higher social status. Touching during an argument can also, to them, mean that you have lost self-control of yourself. And then in the same respect, putting your feet up on the desk or the table is just completely impolite to them. Their communication is considered high context compared to most Americans who have low context, which is just that the mass of information is vested in the explicit code. Chinese people, which we already said, rely more on nonverbal and contextual cues than Americans do. In the past, Chinese people often greeted by bowing. Nowadays, they would walk into a room and say, "Have you had breakfast?" And instead of actually wanting to know whether they had breakfast, they would just want to see a simple nod or yes from the other person, just kind of acknowledging their presence and that they're there. If you would ask them a question like, "Why haven't you eaten yet?" Something like that that requires more than a yes or no answer, this to them would just be very confusing. They often experience shame and embarrassment when they can't communicate, and they will apologize, and frequently if you don't understand them or they can't understand you. Narrowing their eyes towards someone while talking to them is considered a sign of anger or disgust, and excess eye contact is impolite and rude. They oftentimes feel that they are inconveniencing healthcare workers by asking questions, or are even too embarrassed to ask questions, so oftentimes they just don't. If you are taking care of someone who is Chinese American, you need to make sure that you have a translator and that they do speak the right dialect that the individual does. Being in this situation causes Chinese Americans to have a great level of stress, and they tend to be good patients because they're quiet and they don't ask a lot, but it's the nurse's job to kind of suppress their anxiety and fear, and to recognize the nonverbal cues of the patient and their culture, and kind of get them out of their shell and ask them if they truly do have any questions or have any concerns. The nurse should avoid using negative questions, and make sure if they are going to touch the patient that they do explain that it is for a therapeutic purpose. The second thing I'm going to talk about is space. They don't really enjoy being touched. They're considered a non-contact culture. Oftentimes they're viewed as being shy, uninteresting, cold, or impolite, whereas someone of the Chinese descent would consider Americans to be aggressive, pushy, obnoxious, and impolite. They feel more comfortable in a side-by-side or a right-angle arrangement, and may feel uncomfortable when they're placed face-to-face. So when you do sit next to them, maybe angle yourself a little bit more so it's not direct one-on-one. Someone of higher culture can sit as close to you as they want to. It is strictly up to them, and you as a Chinese American just have to deal with it. It's not something that you can choose. The Chinese Americans view tasks that are associated with closeness, increased eye contact, and touch as being impolite or offensive. The nurse can reduce these misunderstandings by providing and explaining the task she's doing, which we already talked about. The nurse should ask for the client's input and kind of ask them, don't be afraid to ask them what the cultural norms are, and be sensitive to this person's personal space. A little bit of difference between Americans and Chinese Americans in the elder population, which there really isn't actually a lot. They are similar than you would actually think. The leading cause of death for Chinese Americans is actually the same as for U.S. Americans: heart disease, cardiovascular disease, cancer, and chronic respiratory disorders. Some of the differences: when our elders tend to get sick, we take them to the doctors, or they go and get an over-the-counter medication from, Walmart or CVS or something. Well, Chinese Americans will often use Western medicine, which is a little more about herbs, and if you have a rash, they expect you to get acupuncture or get stung by a bee or something like that, something that we don't normally do. But besides that, that's really about the biggest difference. They still treat going to the doctor about the same, and they should be treated the same way as well. I hope you enjoyed this presentation.